Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Aspirin poisoning. In aspirin poisoning, there are one difference in aspirin poisoning is metabolic acidosis is seen in children, whereas metabolic alkalosis is seen in adults in aspirin poisoning. Then for aspirin poisoning, we should administer vitamin A, and fresh frozen plasma is administered in the children or in adults. So aspirin, because it can cause metabolic acidosis in children, and also because of the race disorder, aspirin is contraindicated in children who are less than 12 years of age.
thank you and thank you for watching.